For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Romero Morales. I'm a lead public information officer with the County of Santa Clara. Thank you everybody for being here today. Today we're going to be providing an update regarding the ongoing vaccine efforts and the availability here in Santa Clara County. Today we're joined by Dr. Marty Fensterchive, who is our vaccine health officer director, and we will begin this press conference in English. We do not have American Sign Language today, but we'll be uploading this video with captions. We will also have a question and answer section right after Dr. Marty speaks. And right after that, we will move into segments from the podium in Spanish, Vietnamese, Chinese, and Tagalog. Without any further ado, welcome to Dr. Marty to the podium.
Thank you, Ricardo. Good afternoon, everyone. How are you doing? So we want to speak today to the governor's announcement this afternoon, and basically what he said was we are expanding eligibility for vaccinations beginning on April 1st to include everybody over 50 years of age. And then again, on April 15th, we would open vaccinations to all eligible adults, which would mean everyone over 16 years of age. So what does this mean for us? Well, you know, we've been basically talking about having a scarcity of vaccine, and that continues. Just so you know, I was looking to see how many people exactly in our counties does it affect to open this up to over 50. And the number of people in our county between 50 and 64, where we are now, is 400,000 people. So that's a lot of people to add to our list. The supply, again, of vaccine is very limited. We were told in our allocation announcement yesterday that we would be getting 58,000 plus, a few more, of doses of vaccine beginning on Monday for next week's allocation. That does not include the Kaiser system. So that's the most of the providers in the community, excluding Kaiser. And we do have an extensive network which we have built up. However, that 58,000 doses doesn't go very far. We have the capacity to vaccinate over 200,000 people a week in our county, and we're doing probably a third of that. So we have the capacity and the ability to rev up to 3 times what we're doing now, but we don't have the vaccine. And we are concerned beginning next week on April 1st, when we add that additional 400,000 people, that we don't have the vaccine. So we really just want to caution people to please continue to be patient. We are being told by the federal government and the state that vaccine will be flowing a little bit better in the month of April, later on in the month of April. I have no idea how many vaccines that means, but it's been a production issue that all of these manufacturers have not had enough vaccine to send out. So once they are produced and once they're on their way to California, we certainly will put them to use right away. We have been providing vaccines, again, through many sites, through our mass vaccination sites, such as Levi Stadium. We have pop-up clinics, we have community clinics. We have mobile units that are going out to communities that are most impacted. We have the ability also, working with County Fire, to actually go to people's homes that are in-home and can't get out, and that we can go to them and provide the vaccine. So all of that is available, except we don't have the vaccine. We are also, again, really focusing on our hardest hit communities, as I mentioned, to address the equity gaps that are present in our community. So there's a race to vaccinate everyone that's eligible. And I just want to report also that race continues also to get people vaccinated before we see any additional variants developed. But I do want to announce that we had the first case of the P1 variant, and that's the one that was first identified in Brazil, that was confirmed in Santa Clara County. That was done through a random analysis of positive tests that we did get from individuals coming into the community. That person was tested in mid-March after returning from an out-of-state domestic travel. So again, we take a sample of the positives that we have identified, and we put them through a genetic sequencing testing process, and we identified that. So again, we want to really recommend people not travel. We strongly discourage travel for this very reason. Going out into the other parts of this country or parts of the globe, there is a chance of getting exposed and perhaps bringing back one of those variants that we already have here or others that are circulating. We still want to remind people, while you are waiting for your vaccine, again, we will get the vaccine, but while you are waiting, it's really important that we don't give that virus a chance to continue to mutate itself, to continue to multiply itself. And by doing all of the preventative measures, wearing your mask, that's why we're saying to do that. We don't want any more variants. We want to make sure that our vaccines that we have and are utilizing are effective. So far, all of them are effective against these variants to a degree, and we just want to make sure that we keep it that way. As we have already moved into the orange tier and have opened a number of activities or expanded the capacity in a lot of our locations, it's even more important that people stay safe and do all of the things that I'm sure we're all tired of doing, but we need to continue. So we want to get everyone vaccinated as soon as we can, and again, limit the number of potential variants that are circulating in our community. And with that, I will stop.
Please, Dr. Vincent, thank you. And just to sort of build on what you said, infrastructure there, governor optimism there, but the doses are not there. What at this point do you tell people who are optimistic about what's coming, but really don't know how to find an appointment at this point because of that shortage of doses?
Exactly. And so we try to ask people to be patient. We set up our website, which is sccfreevaxvax.org. We have all of the buttons to push so individuals can go and find a vaccine, whether it's their provider. We also have all of the retail pharmacies on there also. So I should mention that a lot of vaccine is starting to flow from the federal government directly to us, to our pharmacies, our Walgreens, our Rite Aids, our CVS's, and so people can go on those sites and get and see if there's an appointment. I can't guarantee there will be one at this point, but keep trying, and there will be appointments in the next coming weeks.
Caroline?
Marty, can you explain two parts? Explain the memorandum of understanding with Blue Shield in the county in terms of the vaccine distribution, and what's the connection between that and the news we hear today from the state?
Well, again, the state decided to contract with Blue Shield as a third-party administrator to help get the vaccines out. We don't think we really have a problem getting vaccines out, but nevertheless, the allocations will be done by Blue Shield. The memorandum of understanding, which we were holding out for, allows the counties, and again, this is going to be statewide, allows the counties to have more flexibility in working with our partners, as we're doing, our community partners, so that we can basically provide the vaccine allocations like we're doing now. We can see what they need, we can give them more or less, and basically be working closely. Before we signed that agreement, it was all very siloed and nobody could talk to one another. So we're very happy that we got that memorandum signed and that agreement approved.
EDC?
So a couple of questions, Dr. Marty. Has there been any movement at the state level in terms of changing the metrics for the 40% doses that's been set aside for lower income? And then second part is involving Levi Stadium, administered doses at Levi. The first, the metrics change.
Yeah, are the metrics changing about that 40% and the 400 zip codes? We don't know. We have certainly made it very clear to the state that we have plenty of areas in our community of high need, those census tracts, smaller community level populations, and we don't know whether they're making any difference right now. But we certainly are focusing on those, irregardless of whether the state is giving us additional vaccine, we are focusing on those areas.
Levi Stadium, can you say how many dosages or
I don't have that information on how many we've done at Levi's, but I can say that Levi's has a capacity of 15,000 doses a day. And we've only had a trickle of that available. So we have a lot of staff that we would like to put them to work up there. And as soon as we get the vaccine, we'll open that stadium at full capacity.
Any more questions before we move to Spanish? Thank you, Dr. Marty.
Thank you very much.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.